Is National Asthma and Allergy Awareness Month, the peak season for those issues for sufferers, and it is also the perfect time to raise awareness. Also a good time to make a difference for Americans living with asthma and allergies. And Dr. Reena Mehta joins us now with more on that. Good morning to you. This is a good time to remind people that this is a serious issue for a lot of people.
Good morning, and thank you for having me. Yeah, May is one of my favorite months because it gives me, as an allergist and immunologist, the opportunity to educate the public about asthma and allergies. Asthma and allergies are very common. 65 million Americans in the United States have asthma and allergies. So as you can imagine, if you have 360,000 people in Louisiana with asthma and allergies, that's 1 in 10 people with these conditions.
65 million people with some degree or another would imply one in five. It may not be an apples and apples comparison, but I mean, it's a serious issue all over the country.
Exactly. So we're talking about United States versus Louisiana, but I mean, it's common, if 1 in 5 or 1 in 10 people have asthma plus minus allergies or allergies triggering asthma, it's serious, and it's something that we should be aware about and educate people about what the symptoms could be.
And this is not a, oh, that's a shame sort of issue. This can be potentially life-threatening?
Oh, absolutely. I mean, there are serious allergic conditions, food allergies, conditions requiring EpiPens that could be potentially fatal, anaphylaxis, and asthma, if it's very uncontrolled, it can certainly lead to hospitalizations, death, things like that.
What are the symptoms? I mean, I think of, sort of just shortness of breath, but what are the symptoms really?
So it depends which condition you're talking about. Let's first talk about asthma. So asthma basically means inflammation in the airways and inflammation in the lungs. And so if your lungs are swollen, that means that you're having trouble getting air out. So you may have cough, wheezing, shortness of breath. And then if you have allergies that are triggering that asthma, symptoms of that could look like sneezing, congestion, itchy throat, postnasal drip, and if enough of that drainage gets into your lungs, that can trigger the asthma to flare.
Do they sort of, obviously, for a sufferer of asthma, it's easy to see how allergies would trigger that. Does it work the other way too, where if you already have an asthma problem, it would seem that if you have a respiratory issue, it's just miserable?
Absolutely, yes. They interrelate. They're dependent on each other in the sense. I mean, if you're inflamed up here, you're likely to be inflamed up here if you're an asthma sufferer. And so actually 60% of people with asthma have allergies, and often that can be a trigger.
So how do you control this?
Great question. So, I mean, I think if you're an asthma sufferer, being aware of your symptoms and basically being able to identify what that is, the shortness of breath, the cough, is really important. Meeting with your doctor regularly to come up with an asthma action plan so that you know which medications to take as a preventative and as a rescue. And a lot of people think that when they have asthma, they need to restrict their activity. Actually, that's false. Obesity is a big trigger for asthma, so staying in shape, moving around actually can help your asthma. And then I think if you're not sure if you have allergies or what your allergic triggers may be, it's reasonable to see an allergist to get testing to figure out what you may be allergic to.
When it comes to young children with this, what should moms and dads look out for?
So children at age 5 and younger are at most risk for hospitalizations from asthma because they get sick all the time. They're getting all of these RSV, flu, COVID, upper respiratory infections. So I think being aware that if you're concerned that your child is having difficulty breathing, it's reasonable to get checked out. If you're seeing the swollen eyes, the itchy eyes, the constant runny nose, your child may have allergies, and that can happen even as young as, age 2. So I think seeing your doctor, getting checked out, getting tested can be really important things to better understand what you can do to control these symptoms.
Good reminders, as always, from Dr. Reena Mehta. Thanks, Doc.